Hello and welcome back to GP Video Podcast by Nadia. So yesterday, as you guys know, that I started talking about brain stroke or cerebrovascular accident. But because I was trying to read it all from a medical website, so I thought it was a bit technical and not very explanatory while I was trying to explain my stuff. But now this is something that I have brought up from Health Direct, which is more for patients in more patient-centered language, and that's what I'm going to share with you today. So we need to, because as I said, that stroke is the second most common cause of death in Western world, while in Australia it is the third most common cause of death. So we really need to know what is a stroke and how can we prevent it, and because prevention is the most important thing. After that, how can we diagnose it and how can we manage it? Okay, so a stroke occurs when your brain cannot get enough oxygen and important nutrients. This is usually because a blood clot or sudden bleed reduces the blood supply. So you know that there are arteries that supply the brain, and there are two ways that these arteries would not supply enough oxygen and enough nutrients to the brain. One is either there is a clot in the artery, occluding the artery so that there is not enough space for nutrients and oxygen to go through, or the artery ruptures and there is the bleed in the brain, so it means again the artery is not functional. All right, so there are two ways for the arteries to not be able to supply blood to the brain, which means the oxygen and the nutrients. And when brain or any part of the body does not get enough oxygen and enough nutrients, that part of the brain or that part of any of the body organ that dies. And when it dies, it means that it cannot function. And when any part of the brain cannot function, as you know, that brain is the master organ of our body and it controls all parts of our body. So whichever part of the brain dies, that limb or that organ, or for example, if the part of the brain that controls the arms dies, then of course your arms are not going to work. If that part of the brain that controls the legs die, your legs are not going to work. So this is how it works. So this is the definition of stroke. Signs of a stroke can include a drooping face, difficulty moving your arms, or slurred speech. So whenever stroke happens, there is actually a four things that we really want to assess. It's called face, arms, speech, and time. So face, has their face or mouth drooped or dropped? Okay. Number two, arms, can they lift both arms? Number three, speech, is the speech slurred? Do they understand you? And then time is very, very critical, because from the time the stroke is happen till he or she or the patient gets management, that is very, very, very critical. Okay, so there are three things that we look at again: face, arms, and speech. Face, arms, and speech. So face has any of this angle of the face has dropped, or any of the part of the face is asymmetrical. Number two is arms, can they lift up their arms? You can ask them to lift up their arms. And number three is the speech, has the speech slurred? And there are other symptoms as well, but again, when we try and quickly assess if it's a stroke or not, so these are the three things we look at: face, arms, speech. Face, arms, speech. Has the face become like one part has dropped, or any asymmetry in the face that you can see, any drooping of the eyelids, drooping of the angle of mouth, anything. Then number two is, can they lift both arms? Both arms should be there. Both arms. If one of the arms is not cannot be lifted up, it means that it's stroke. And number three is a speech. Is their speech slurred? Do they okay, again, then there comes two kinds of speech: expressive speech and receptive speech. So number one is, has their speech slurred? Number two is, do they understand you? So again, I would like to reiterate the fact that face, any asymmetry in the face, including dropping eyelids, dropping angles of mouth, and any kind of asymmetry you can see in the face. And arms, both the arms, they can lift up. So see, if any one of the arms cannot be lifted up, it again means it's a stroke. And number three is a speech. Is the speech slurred? Do they understand you? So in these three, face, arms, and speech, in these three things, any of the symptoms, so maybe for example, only one arm cannot be lifted up, or maybe for example, they cannot understand what you are saying, or let's say only one of the angles of the mouth has dropped, or one of the eyelid has dropped, or let's say if the speech is slurred only, there is no, any one of these symptoms means it's a stroke. You have to act as if it's a stroke and until proven otherwise. So it's very, 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 very important. Why am I saying it's very, very important? Because the time period from the first symptom till you take them to hospital and till the management is started, that time period is very, 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 very important. Okay, let's go back there. So, signs of a stroke can include a drooping face, difficulty moving your arms, or slurred speech. If you notice signs of a stroke, you have to call 000 immediately, since any delay may lead to permanent brain damage or health. So, the thing is that as soon as the management is put in the place, we can still save that dying part of the brain. Maybe it hasn't become dead yet. So, it is very, very, very important that you just call 000 and reach hospital so we can institute the management ASAP. You can reduce your chance of having a stroke by managing risk factors such as high blood pressure and cholesterol. High blood pressure and high cholesterol. Eating healthily and exercising will also help. Okay, again, what is a stroke? A stroke occurs when the blood supply to a part of your body, part of your brain is suddenly reduced. This prevents your brain from getting oxygen and other nutrients from your blood. Your brain needs a continuous supply of oxygen and nutrients from your blood. Without oxygen or nutrients, your brain cells die and the affected area can suffer permanent damage. There are two main reasons of reduced blood supply. One is a blood clot. Number two is a bleed. 1 in 4 people will have a stroke in their lifetime. 1 in 4 of us will have a stroke in their lifetime. So I will again come back to this next time. But as I said, that high blood pressure and high cholesterol are most important risk factors that we can work on. I hear so many of my patients when they come to me, and unfortunately I diagnose them with high blood pressure or high cholesterol, obesity, fatty liver there, and I want to put them on medications because they have tried their level best with diet and exercise and it hasn't helped them. And then I get to hear that, oh, the whole life we haven't been on any medications and we would not prefer to be on anything like for now as well. And my question to you guys is it better to be on medications or is it better to suffer a stroke or a heart attack? See, the medications again could be very, very short term as well. So if you take medications and in the meanwhile work on your lifestyle factors as well, then there could be a time, like maybe let's say after 6 months, 1 year, 2 years, you could go off your medications. But that time period is very, very important. You do not want to have a stroke or a heart attack in your young age or even in your old age. So if you have to be on medications, you have to be on medications. There is no shame in it. There is no problem in it. I don't know why is the stigma attached to taking medications. I just don't understand that. Anyways, we'll come back to this tomorrow.